Hey out there, YouTube. This is Real Nurse Talk. I'm Nurse Jessica. Thank you for tuning in this week. I have a fun video for you this week. It is 15 things every nursing bag needs. This is going to help you a lot, especially if you're a new nurse and you're like, what do I put in this giant bag? You might be putting in things you're never going to use, and you might be forgetting other things that you're really going to need. So if you are new to this channel, again, I'm Nurse Jessica. I do nurse interviews. I do videos about tips for nursing, what it's like to be a nurse. I also do videos for patients on what it's like to be in the hospital and how you can make your hospital stay a little more smooth. If those are things that interest you. I also do videos on sort of general healthy living. So if those are things that interest you, please like, subscribe, comment below, and ring the bell for notifications. I drop videos every Wednesday afternoon. And let's get to it. Okay, 15 things you need to bring in your bag. I have my little sticky note here that I wrote everything on so I won't forget. And I'm just gonna just gonna leave that right here. Okay, first thing every nursing bag needs. Well, first let's talk about the bag. This is my nursing bag. I love this bag because my husband got it for me. It folds up and zips up into a little pouch and it has my name on the bottom. So if I would have picked my own nursing bag, I probably would have gotten something with a little more pockets. But I have bags within my bags to help with that issue. So this is my nursing bag. It's nice because I can wipe it off at the end of the day with special wipes to get the germs off. Okay, so first thing that your nursing bag needs is a water bottle. Please stay hydrated, okay? As I think a lot of hospitals will have places that you can keep your water bottles. Sometimes you're not allowed to have them on the desk per JCO, but have it as close to you as you can. You need to be sipping on this all day, otherwise you're gonna be sorry. Number one, water bottle. Number two, stethoscope, which I mean, duh. If there's two things you absolutely need to bring with you to your shift, it's your stethoscope and your badge. I mean, you just can't perform your job without those things. So if nothing else, please bring that. So this is my stethoscope. It's a Littmann. For everything I need to do, it's perfectly fine. You could also spend like $200 on a really fancy stethoscope that I'm sure works much better, but I think as for the level of assessment we need to do, this is just fine. Okay. The next thing is your report sheet. So I've done different things depending on where I work. When I was, so in the ICU, we have clipboards that have the report sheet on it, and we just write on that when they're admitted, and we kind of like pass that back and forth. You can add to it, erase from it, and that works perfectly fine when you have 1 to 2 patients. And then I'll usually just have another piece of paper where throughout the shift I'll write down things I need to chart, like I's and O's, temps, residuals, meds, etc., etc. However, that did not work for me when I was doing med-surg. For med-surg, what I would do is get a piece of paper. I would fold it into 4s. Usually we'd have 6 patients. So that's 1, 2, 3, 4, 5, 6. On each square, I would do this. On each square, can you see it? Yeah. I do a line like this. Here, I would write everything I needed to know about that patient when they're giving me a report, their diagnosis, their allergies, their code status, when they were admitted, basic history, what kind of O2 levels, activity levels, dietary, blah, 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 blah. So I could do that on 1, 2, 3, 4, 5, 6 patients. Then down here, I would do a to-do list, and that's where I would write everything I need to do, because if you're writing different things in different squares that you need to do, it's all scattered, you're not going to remember. Just write it under to-do list, you always know to go back there. So that's 3, your report sheet. 4 is pens and Sharpies. I carry my Sharpies right here on my badge. So anytime, this is especially important in like acute care settings like critical care where you need to constantly be marking, sometimes hourly, what's going out of chest tubes or NG tubes or what have you. Everything needs to be signed and dated. Wound care. So with pens, you don't have to use the pens I use, but these are my favorite pens. They are Pilot pens called Precise V5RT, and they're clicky. You need to have clicky pens. They come in cool colors, obviously black or blue for anything official. And they write like what I imagine a quill and ink would write like, which is fun for me. So that's what I like. Number 5. Lotion and chapstick. How many times do you wash your hands? 5 million times a shift. So bring some lotion that you like. Some places you can only have unscented. That's fine. Bring an unscented lotion that you like. And chapstick for your lips. You don't have to have that, but for me, that's helpful. I like chapstick. Burt's Bees Pomegranate is my favorite if anyone cares. Number 6 is gum. So whatever gum's on sale is what I get. Here's my chapstick, here's my gum. Because sometimes you just need to like freshen up in your mouth. I mean, you walk into some interesting smells, and sometimes just like breathing in that air, you just need to refresh. Okay, so that's number 6. Number 7 is Motrin and Tylenol. Ladies, maybe it's that time of the month and you need a little Motrin. Maybe you have a headache. Also, let's see, where's mine? So that's good to have. Also, I can't tell you how many times people have asked me if I have Motrin. And it's just kind of funny because you're in a hospital, but obviously you can't take the Motrin from the pharmacy. But it's like water everywhere, but not a drop to drink. But anyways, have Motrin or Tylenol. That's number 7. Number 8 is hair ties. Where are my hair ties at? I've just got a bunch in here loose. So hair ties are good for you. They're good for a friend. Sometimes they're good for patients too. I think especially like in the ICU, you have people that don't move very much. So when you're giving them a bath, you could just like braid their hair, put it in a bun on top, and they're a little less likely to have crazy dreads by the time they leave. Okay, that's number 8. Number 9 is snacks. Just bring you some snacks, because ideally you get half an hour to go have lunch, but sometimes all you have time to do is chow down a granola bar in the break room really fast. Healthy snacks are better. Like for me, for example, I love to bring like walnuts and raisins or some sort of nut with some sort of dried fruit. That's a good snack that has protein, it has fat, it has carbs. It's going to last you for a while until you can hopefully maybe have lunch. Number 10 is a phone charger. Not that we're on our phones at work. That would be ridiculous. But sometimes maybe you forget to charge your phone, and I mean you're at work 12 hours, and especially if you have kids, you need to be checking your phone at least sometimes. This also helps patients. A lot of times they don't know they're going to be admitted to the hospital. No one's had time to bring them a charger. Their phone's kind of like their lifeline, and then you can help them out. That's 10. 11 is a watch. Any watch will do. With a second hand is best, or with one that marks the seconds digitally. So you can, if you need to, count respirations manually or do a manual heart rate if things are looking funky on the monitor or what have you. Also, you always need to know times, especially like if you're in a code situation or something, you need to know when that happened, when these meds were given. There will be a person designated to mark all of that very attentively. But if you're in there first, at least you can be like, okay, what time is it? All right, 13:21, we're started. Watches, yes to watches. Okay, 12, flashlight. I also have this on my badge. These are super nifty. And that's, to check pupillary response, mucosal membranes, or you're a night nurse and you don't want to wake someone up. You just got your little flashlight if you need to see something. Perfect. Okay, 13 is a clipboard. I use it less now, but I used to use it a lot, especially on med surg. I happened to win one when I was in nursing school in a raffle. That's super cool that I get a lot of compliments on and people ask for. This, I don't know how much it cost thusly, but this is a white coat clipboard. It has really awesome references, like standard settings for reading EKGs, basic labs, where to give IM shots. That one I kind of feel like they should take off here because how often do you give an IM shot? Not very often. Yes, ABGs, super useful. And then you've got that with you. Number 14 is some sort of caffeine, although I would strongly urge you go to the water before you go to the caffeine. No one believes me, but being hydrated works better than drowning your body in caffeine. And you want to be alert, but you don't want to be like over here tachycardic about to pass out because you're so jittery. So one that I really like is Zip Fizz. Zip Fizz is cool because it has caffeine. It doesn't have an insane amount of caffeine, about 200 milligrams, but it's also got a ton of vitamins and B12. And I'll put it in my giant water bottle, so I'm getting my water and I'm sipping that throughout the day. And then I'll usually try to have an additional water bottle that's just water. And I feel like it works really well and it keeps me going, but it doesn't make me jittery. So that one's good. Okay, last one, number 15 is a jacket, which I don't have right now, but I think you know what a jacket is. So it gets super cold when you are at the hospital. It's always cold. So just bring a jacket, even if it's the summer. All right, guys, that was my 15 things to keep in your nursing bag. Hope that helped. Like, subscribe, notifications, comments. This is Real Nurse Talk. Have a healthy week.